Welcome back to the Healing Nurse channel. This is your girl, Nurse Coach Shell. In today's episode, we will be continuing our series on understanding diabetes. Today, we will be going over gestational diabetes. Before I begin, I want to put out a thank you to anyone who has subscribed to my channel. And if you have not done so already, I ask that you please hit the subscribe button to help grow this channel that focuses on healing mind, body, and spirit. We don't only talk about chronic illness on this channel, I talk about everything related to you. Mind, body, spirit. It can be chronic disease related. It could be mental health related. It could be about simple life issues that we're going through. It could be about the political climate we're experiencing because all of those things impact us as an individual, the whole being of us. And we need everything to be in balance in order for us to remain happy, healthy, fulfilled individuals. Before I get into this week's content on gestational diabetes, I want to put out an apology because I kind of got off track with posting videos due to an unexpected loss within our family over the past 2 weeks. It has been a lot going on, total chaos of not so much chaos, just a lot of stuff going on due to an unexpected loss of a family member. And so now I'm trying to get back on track with things. The other disclaimer I want to put out there is I am a brand new channel. I am just beginning this journey here of creating this community that focuses on healing mind, body, and spirit. I am also brand new. Nurse coach who is helping individuals find a new pathway to a more fulfilling life that they may feel that they're lacking. And my company, which is called Blossoming Souls Nurse Coaching and Concierge, the concierge portion of my business is kind of on hold right now. And it's only limited to the my immediate area, which is in the Midwest in the Twin Cities of Minnesota, Minneapolis, St. Paul area. But as far as the nurse coaching portion of my business goes, that is available to anyone here in the United States because it requires that I use my actual nursing license and I have to be licensed in the states in which I practice. So out of the country, I cannot practice as per se a nurse coach that gives information on chronic disease, chronic illness, medications, and that sort of thing. But what I can do in other countries is discuss the other things related to your holistic being, meaning your mental health, things going on in life, our political climates, the things we're living through as a collective group of individuals. I also focus on spirituality, and walking away from the construct of mind control that we've been living under here in this world in this present time. And so with all of that being said, the other thing I want to throw out there is that I am a brand new channel. I'm quite the novice to this whole creating videos, editing, and all of that stuff. So my channel is not as mainstream as a lot of these other videos that you may run into. I am not in a competition with anybody, but I do believe that this is my calling. If you have not done so already, please check out my other video that I've uploaded, titled Who is Nurse Coach Shell? In that, I kind of give a little background into who I am and what makes me think I am qualified to be a nurse coach, to offer any information on not just the chronic diseases and medications, but also the holistic approach, mind, body, spirit, and what I've walked through already on this journey. It's just a small portion of what I've lived through. And as I continue to make videos, I will share more and more parts of me because I believe wholeheartedly that this is where I belong. This is what I'm supposed to be doing. Right now, we are in a time of knowledge and information and weeding out things that no longer help us progress and be better human beings. And as a part of that, there's people out there that are meant to be educators and leaders and truth tellers to this journey. And I believe that I am one of those individuals. And so my focus and goal is to give education in all aspects of life, not just chronic illnesses and medications. The other thing I want to put out there is that, again, I am a new channel, so I don't have all of the know-how of a lot of these other channels that have like the neat graphics and the two screens and all of these other things. Eventually I will get there. I just ask that you please be patient with me, keep coming back, help support so that we can build this community of like-minded individuals who are interested in a holistic approach of becoming the best versions of ourselves. That is the goal, right? To become collective, individually better so that we can become collectively better. That is what we're here for. Not to be put in boxes, not to be led by somebody else, but to be able to go within, heal completely so we can show up as whole individuals that can contribute to the collective versus pull away from it all the time. So now that I've gotten all that out, now let's focus on gestational diabetes and what that is. So gestational diabetes is the form of diabetes like type 2 that fortunately can be reversed if properly managed, and once pregnancy is done is usually gone or goes away. But gestational diabetes is the type of diabetes that occurs during pregnancy, and it's usually found during the weeks of 24 to 28 weeks of gestation. It's typically diagnosed through a two-step process, usually around that 24 to 28 week mark. You go into your obstetrician office, into your provider's office, and they will do something called a glucose tolerance test. And within that test is where you are put or forced to drink this disgusting sweet drink. I don't like it. Some people don't mind it, but what it reminds me of is a very flat Sprite with a ton of sugar added to it. And once you drink this concoction, you sit in your doctor's office. I think it's an hour, and then they draw your blood to see what your glucose level is. And depending on what your reading comes back will help them determine if you possibly have gestational diabetes or not. The difference with gestational diabetes diagnosis is this is a two-step process. So if your glucose tolerance test comes back positive, then they'll have you do another step testing, which is a longer form of that type of glucose tolerance test. So they'll have you come back another day. And at that time, you'll drink another concoction. They'll do a blood draw at 1 hour. I believe it's 1 hour, 1 hour, I think every hour for 3 or 4 hours, they check your blood, do blood testing, and to see if your glucose level decreases, increases, stays the same, or whatever. Based on those numbers, that will determine if you are in fact a type 2, or excuse me, if you have gestational diabetes. And if you are confirmed to have gestational diabetes, you will be placed on the same type of regimen as a type 2 diabetic, where they will give you education on how to do blood sugar testing throughout the day, what numbers to look out for, what's too high, what's too low, what symptoms to look out for. They'll have you record your blood sugars at specific times of the day, usually before you eat. And then so for some people, they'll even have you check your blood sugar several hours after eating to ensure that your numbers come down. Oftentimes, they may have to, depending on your numbers, have to place you on medication to help manage your blood sugar readings. And typically, they'll start with low dose of metformin or insulin to help manage your blood sugar readings. Because if your blood sugars remain extremely high and untreated, it not only puts you at risk for complications, but it also puts your baby at risk. And so usually people who are at risk of even developing gestational diabetes are typically people who have who are overweight or obese before becoming pregnant. If they have a family history of diabetes, if they've had previous pregnancies where they've delivered babies that were well over 9 pounds at birth, if you're a little bit later in pregnancy, which is mind blowing to me, but usually once you get up in age around 25 and older, they start considering you to be a geriatric pregnancy. And so those people are at an increased risk of developing gestational diabetes, as well as those who, before pregnancy, had a history of pre-diabetes, which is that hemoglobin A1C that I discussed in previous videos, that a hemoglobin A1C of 5.7 to 6.4, that range is typically considered pre-diabetic, or if you have a history of something called PCOS. And if you're unfamiliar with PCOS, what that is polycystic ovarian syndrome that occurs in women where they have the development of small cysts that form around their ovary that can cause hormonal changes and imbalances within the body and create a ton of symptoms for women who suffer from PCOS. I'm not going to go into detail about PCOS on this video, but that is something, if you've never heard of it and you're interested in learning more about it, that you can go look up whenever you get time to do so. And then, so those are usually the people who are most at risk of developing gestational diabetes when they do become pregnant. And symptoms are very similar for gestational diabetes to the other forms of diabetes. It's pretty standard across the board for symptoms related to diabetes, which include extreme thirst, frequent urination, some fatigue, and in some later cases, some people even develop blurry vision. And so those are things to look out for as far as symptoms and determining if you're at risk for developing gestational diabetes, etc. Now, if you have been diagnosed with this gestational diabetes, the things that it puts your baby at risk for, the complications that can come about as a result of having gestational diabetes, not just for the baby, but also for mom. We'll start with baby first. For babies, it usually will result in excessive birth weight, something called macrosomia, where your babies are super big when they're born, greater than 9 pounds. That's those people who you see delivering babies that are like 10, 11, 12, 13-pound babies, huge. Oftentimes, because the babies are so big, it puts them at risk for a preterm birth where they end up going into labor too soon before their delivery date. Babies can often come out with low blood sugars at birth, something called neonatal hypoglycemia. And then they also have an increased risk of breathing difficulties at birth. And also they have the risk of developing obesity or type 2 diabetes later on in life. And that's just the baby. Moms, however, run the risk, excuse me, my nose is itching like crazy. Um, it puts mom at risk for high blood pressure, something called preeclampsia, which is extremely dangerous during pregnancy. It can cause complications during the delivery, requiring mom to need a C-section, or they may have experienced some type of birth traumas. It also puts mom at risk for developing type 2 diabetes after delivery or postpartum. So that's why early detection and action management is so important, because it's not just protecting you, the mother, but it's also protecting your unborn baby as well. So I'm going to go into discussing managing blood sugar, but it's going to be kind of a repeat of what I've already discussed in the other videos. So, big thing is during pregnancy, with pregnant or excuse me, diabetic or not, you want to eat a well balanced diet, and you want to avoid things that are going to spike your blood sugars and then cause it to crash. So, things that you want to avoid again are those processed foods, things in a can, frozen in a box. I know times are hard. I know it's difficult to even feed. In a lot of families, it's difficult to even have enough money for food and all of these things. And it's easier to get those highly processed foods because they're cheaper and they usually come in a larger quantities where it feeds more people. But if there's any way to offset some of that by making better choices, so instead of soda, juices, and pops, try water with fresh fruit in it. Instead of eating candy and that sort of thing, try getting fresh fruit and putting it in the freezer and enjoying it like that. Instead of ice cream, try Greek yogurt with fresh fruit in it. Instead of white rice, try brown rice, quinoa, beans, lentils, those sort of things. So you'll also want to pair your carbs with a protein. So like lean chicken, small portions. You don't need a big old hawking whole chicken quarter on your plate. That's just excessive, but that's something we've been taught here is to go above and beyond, and it just is unnecessary. And that's why we have so much obesity in this country, is because not only are we eating poor options, but we're eating it gluttonously. There's no need to have that much food on your plate in one sitting. That's why it's important to have multiple small meals throughout your day. Instead of the standard three that we've all been taught is the way to go, try um, spreading it out to 5 to 6 little small meals throughout the day. So you could start with a nice breakfast in the morning that includes like eggs and some whole grain toast and maybe a piece of avocado or something. If I'm allergic, so that's not an option for me. And then doing a mid-morning snack that has like that you're eating apple or a piece of fruit, some celery with peanut butter or almond butter, something like that. And then for lunch, have a reasonable lunch that could be something like a grilled chicken salad or a chicken Caesar salad with some quinoa or chickpeas or something in that. And then for a mid-afternoon snack, you could do something like a Greek yogurt with fresh fruit in it. And then dinner, have a nice balanced dinner that has like a fatty acid or goodness, I'm getting tongue tied. A healthy um I'll just say salmon and a quinoa with a nice steamed vegetable with it. And instead of a juice, soda, or anything like that, you can drink um, water with fresh fruits or vegetables within it. Other things to manage your blood sugar numbers, as I said in the other videos, is moving consistently and safely. 10 to 30 minutes of daily movement is necessary, be it pregnant or not. Walking is good. You could do some prenatal yoga. You could do swimming, um, prenatal Pilates, simple, nice, flowing movements to help get your body moving, but don't make it too strenuous because strenuous, stressful activity can spike your blood sugars. You'll also want to try to incorporate these movements after food, after eating, and this can lower your potential for those blood sugar spikes and crashes. You'll also want to monitor your blood sugars consistently throughout the day, usually about 4 times a day. You'll want to check it before you eat, and in some cases, depending on what your numbers are, after you eat. But if you check it after you eat, you need to at least wait 3 to 4 hours, probably 4 to be on the safer side. But A minimum of 2. Don't go eat and then go immediately check your blood sugar, because that's going to give you a false high. Of course it's going to be high. The question is, how long does it take before it goes back down? That's what they're looking for. Even non-diabetics right after eating may have a higher blood sugar, because your body hasn't had an opportunity to kick in that insulin to break that glucose down into energy. So do not check your blood sugar immediately after eating. You're going to get a false high if you do that. You'll also want to be very cognizant of your body. Nobody knows you better than you. You know when your body doesn't feel right, when it doesn't feel good, what makes it feel good, and all of those things. Now, I do understand that unhealthy things make your body feel good in the immediate. The question you need to ask yourself is, after that immediate time has passed and a little time has gone on, how does your body feel after that? And if it starts making you feel icky, crummy, you eat a big heavy meal and then now all of a sudden you have the itis where you need to take a nap and all of those things. If you're getting to a place where you're eating and you always need to take a nap after because you've developed the itis, it's probably because you have eaten something that made your blood sugar spike, then crash, and that is unhealthy for you. So you'll usually see that like during holidays, like Thanksgiving, when you eat all of those high carb foods, mashed potatoes and macaroni and cheese and, all of those starches and all of that, all in the same meal on the same plate, and tastes good. You're happy in the moment, but then all of a sudden you start feeling icky because now you got the itis, because now your blood sugar done crashed. That's not healthy for you or your baby, be it pregnant or not. And so you want to watch out for things that are going to spike and crash your blood sugar. Also, you want to get enough sleep every night, minimum of 7 to 9 hours, minimum. If you can get upwards of like 10 hours, awesome. But I get it. Who can sleep that long? A lot of people are programmed now to where some people can't even sleep past a certain time, where their body is on automatic, where they get up no matter what, even if it's their time, if it's a time for relaxation. They can't help it. It's just how their body is programmed, which is fine, but just make sure that you're getting at least a minimum of 7 to 9 hours of rest to keep you, your hormones, your blood sugar levels even keel, and not doing all of this up down, spike, fall, spike, because that's not good. Not just in the immediate, but also long term. That's when you start creating those damages to other areas of your body. So some other treatment options for you if you are diagnosed with gestational diabetes. So again, for medication, they may start you on some insulin, because it is safe for pregnancy. It doesn't cross the placenta, and it's usually what they give you if your fasting glucose is just too high and diet and lifestyle is just not enough to maintain it. If you're still having some insulin issues, they may also incorporate other medications like glyburide or metformin, which are oral medications that help manage your blood sugar numbers, um, 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 because you're having insulin resistance, but they prefer to go insulin first, because the glyburide and metformin, even though they're safe for pregnancy, they're still not 100% guarantee, right? Now, there are some potential side effects to watch out for all of these. If you're on insulin, the symptoms you want to watch out for are risk for low blood sugars, as well as injection site tenderness, and that can be for any diabetic. If you're on insulin, you want to rotate your injection sites. Every time you give yourself an insulin shot, you want to not go right back to the same spot. Rotate all around. You got a big surface area. They say go into your abdomen, but if you're someone who doesn't want to do your stomach, that's the best place to go, but you have other options. You could also put it in the fatty portion on the back of your arm. Some people have put it in their thigh, but they prefer your belly if at all possible. For glyburide, the biggest side effect that you want to watch for is it could potentially increase birth weight. So if gestational diabetes itself already puts you at risk for increased birth weight, you probably want to avoid glyburide, but that'll be up to your healthcare provider. I'm not I cannot prescribe medications, but I can give you the lowdown about them. Metformin, the side effects, the biggest issues with metformin is because it impacts the nerves within the belly, within your abdomen. It could put in your stomach, it could potentially increase issues with nausea or diarrhea. Nausea, vomiting, diarrhea are common side effects with metformin. Metformin is cost effective. It's usually the most commonly used oral medication that they prescribe. It's usually the first line that they go with for treating diabetes. But if you notice that you're having increased nausea, vomiting, or diarrhea, discuss this with your healthcare provider because they may want to take you off of metformin altogether. And then once baby is born, what could transpire after birth? For mom, the blood sugar usually returns back to normal. That's normally what happens. However, women who are within 10 years, for some women, about half of women who have had gestational diabetes after birth, about an average of about 50% is what they are finding will later on develop type 2 diabetes. You're at an increased risk of developing type 2 diabetes with gestational diabetes, but up to 50% of women after birth end up developing type 2 diabetes within 10 years postpartum. It could be a combination of things like lifestyle choices that you may have changed during your pregnancy but went back to after you delivered your baby, or it could just be genetics. It could be, it could be a number of things, but up to about 50% of women who have gestational diabetes are likely to develop type 2 diabetes within 10 years after giving birth. But don't let that alarm you, because remember, type 2 diabetes as well as gestational diabetes have the potential of being reversed. Lifestyle choice. Lifestyle change. Make it a lifestyle habit. Don't just do it for the moment. Make it something that is set in stone and there's no changing it going forward. And that will give you the best lasting results. You can have cheat days, but don't make it every day be a cheat day. You get what I'm saying? Okay. So, steps to take after giving birth. Maintain that healthy eating pattern. Keep that up. Keep going with the physical activity. But now that you've had your baby, now you can increase the intensity of those exercises, getting that heart rate up, getting the weight off. You want to get that weight off as quickly as possible. Usually breastfeeding helps regulate not just your blood sugars, but it also helps you decrease your weight after birth. A lot of women who breastfeed after giving birth notice that their uterus goes back down quickly, their belly fat almost vanishes, and all of that is related to breastfeeding, because that is technically what we should be doing as women after we give birth. I'm not saying that to shame any woman who does not breastfeed. I didn't breastfeed my kids. Looking back now, I was young, but looking back now, I wish I had. It probably would have given them a better blueprint to start off with in their immune system, but it is what it is. They're adults now. But you also want to schedule regular glucose follow-up checkups with your healthcare provider. Getting those hemoglobin A1C checks every 3 months to ensure that your blood sugar numbers are getting down below the pre-diabetic mark, which is below 5.6, right? Below 5.7. So, getting regular glucose checks will be important. Prioritizing your sleep and stress management. High stress is going to lead to blood sugar, blood pressure, all kind of complications, right? Not just from pregnancy or just from diabetes, but high stress levels, which releases continuous cortisol into your system, which is a hormone that should only be released in immediate situations and then cut off. But if you're constantly under high stress where you're living under fight or flight all the time, then you're probably pouring cortisol out all the time. And what that does, that stress hormone does, is it eventually starts creating inflammation within the body, which leads to dis-ease. Dis-ease means chronic illness development due to inflammation. So to reduce the risk of that, go ahead and manage your stress in whatever ways possible. Mindfulness, meditation, yoga, Tai Chi, having a good support system, uh, talk therapy, journaling, all of those things that I've already discussed are awesome ways to manage your stress. Also, you'll want to prioritize your sleeping habits. Minimum 7 to 9 hours per night if possible. Okay. So, just a couple more tips that I want to give before closing out this week's episode on understanding diabetes. Some long-term tips to keep in mind is you don't want to wait until you develop symptoms, right? When you start getting symptoms, then that's probably because you've ignored all of the other cues your body was trying to give you. That little pain may be an indication of something. Don't just overlook it and dismiss the things that your body is doing out of too busy, it's nothing, dismissive, etc. Because your body is a machine, and I've said this before. It is an awesome machine, one of the best machines developed through the creator, right? And that machine has to have maintenance like any other machine. And not just like your car will give you a little dink because something's wrong, the same with your body. It will start to notify you. Anything that feels out of whack is your body trying to warn you of something, be it immediate danger, the development of a disease or an illness or a virus, whatever. Your body tells you before the symptoms actually start to show up. And once the symptoms start to show up, that's usually too late, because now you probably have developed the actual disease itself. So you want to stay on top of it. Get your yearly checkups. Don't prevent those things. Get that good support team, be it your doctor, nurse practitioner. You can get a dietitian, a nutritionist, a therapist, a coach, whatever it is. But you want to stay proactive and have prevention be your goal, and not symptom management later. And remember, emotional support is one of the best things you can do. Getting a solid support group. Join a postpartum support group or a diabetes support group if you have to. Talk to a therapist if necessary. Get a good group of friends who you can run things by and vent to and discuss and etc. Get some books, go online, go on YouTube. There's so many resources available right at your fingertips. You just have to do a little bit of digging to find them, but they are all available right there to you. A lot of this stuff is free. Now, some final thoughts before I end this video here is, remember, you are not your diagnosis. You're not. You are so much more than that. That is just one little portion, part, and piece of the amazing being that you are. And so, with every healthy choice you make, you are writing a new opportunity, a new story for yourself and for your future and for your baby, for your family. All of the tools are right there and easily, readily available for you when you're ready for them. And so, when you do all of those necessary steps to ensure that you're healthy and happy and making sure your baby is healthy and happy, it will create a happy, healthy environment for healthy growth, healthy upbringing, and just stability and peacefulness, the joy and all of those things that we all seek instead of being bogged down with the burden of not feeling good, not feeling well. Remember, everything we do in this life as an adult is a choice, period. I don't care what anybody else tries to say. If you are an adult that is mentally competent and sound, then everything that goes on in your life is a choice, and you are the author of your story. So don't forget that. Don't keep passing off as a victim, blaming other people for what's going on in your life. It is a choice, and the choice is yours, be it good, bad, or otherwise. Okay. All right. So I'm just going to end this here right now. Thank you so much. Next week will be the final episode of Understanding Diabetes, where I am going to talk about type 3 diabetes, something that is coming of more and more knowledge is coming out about it, and I'm excited to share with you what type 3 diabetes is and all of the good valuable information that I can dig up about it. But that will be in next week's episode. If you have not already done so, please hit that subscribe button. um, please comment, share. Also, let me know if there's some topics you would like me to go over and discuss. Because, like I said, it doesn't always have to be about chronic illness. I am the connoisseur of information. I kid you not. I have books everywhere, and I've done this my whole life. And I think that is a part of my journey here this go round on this on this earthly plane, is to gather knowledge and share it. Share what I know. And it gives my heart so much joy. If I could do this all day, every day, I would literally be in heaven. I pray every day that I get the opportunity to do just this. Not just make YouTube videos, but provide support and advocacy and accountability to my coaching clients, and I hope to provide educational material, information, data, whatever, to those that follow my blog on Substack and my TikTok. And I don't go on TikTok too much because I'm anticipating the big shift that they're planning to do, where it's now owned by um, the United States versus the original owner. So now they have way more oversight and direction on what they are allowing on the platform, etc. I just don't want to be involved with all of that. So for right now, I'm on YouTube, I'm on Substack, I am on TikTok right now, but just very minimal. I don't post very many videos on there. Most of the stuff that goes on TikTok has already made it to YouTube. And then I'm on Instagram also, but not very active, as much so as I am here on YouTube, especially going forward. All right. So this is your girl, Nurse Coach Shell. Thank you so much for coming back and spending this time with me and understanding diabetes. This week we focused on gestational diabetes and what that looks like. And again, next week we will tackle type 3 diabetes, and go from there. All right. Thank you so much for joining me this go round. I look forward to seeing you again next week. Please comment, share, and subscribe if you haven't already done so. All right. Have an awesome, awesome day, and